Millions of men around the world are facing a silent health challenge, one that hardly gets talked about. Yet the impact of staying silent is real, quietly affecting the lives of fathers, grandfathers, brothers, and husbands everywhere. Hi, I'm Barbara O'Neill. Over decades in my career, I've treated thousands of men dealing with the normal changes that come with aging. But there's one conversation I believe every man over 60 should have, not in whispers, not behind closed doors, and certainly not too late. This is a conversation about your prostate. More importantly, it's about simple, natural daily habits that can protect, restore, and even improve your prostate health. These are not gimmicks. What I'm sharing comes from real science. Evidence-backed strategies used by researchers and clinicians worldwide to help men age with fewer complications, less discomfort, and more freedom. If you are over 60, or if someone you care about is, I encourage you to stay with me. The 5 daily habits I'm about to share may seem small, but together they can have a huge impact. One of them may even surprise you, so watch closely. This could be the most important video you see this year for your prostate and sexual health. To understand why these habits matter, it helps to know a bit about the prostate itself. This small gland, about the size of a walnut, sits just below the bladder and wraps around the urethra, the tube that carries urine out of the body. It has an important role in male reproductive health, producing seminal fluid that nourishes and transports sperm. Most men don't even notice it until around age 50. But once you hit your 60s, the prostate often begins to change, and not in a good way. Doctors call this growth benign prostatic hyperplasia, or BPH. It isn't cancer, but it can be disruptive. According to the National Institutes of Health, over half of men in their 50s already show signs of prostate enlargement. By age 70, that number jumps to more than 80%. What does this look like day to day? For many, it starts subtly. A weaker urine stream, the feeling that the bladder never fully empties, trouble starting urination, or frequent nighttime trips to the bathroom that interrupt sleep and drain energy. Many men assume this is just part of aging, but that's a dangerous myth. New research shows that inflammation and enlargement of the prostate can be improved or even prevented with daily habits that manage hormones, blood flow, and inflammation. So let's start with the first habit. Number 1, strategic hydration. Hydration is one of the simplest habits to implement, yet it is often overlooked. Drinking enough water consistently throughout the day does more than just keep you from feeling thirsty. It directly affects the health of your prostate and urinary function. As men age, the sense of thirst naturally diminishes. Many older adults go hours without drinking water, only hydrating when their body has already begun to experience mild dehydration. This leads to urine that is highly concentrated and acidic, loaded with waste products that irritate the bladder and can aggravate the prostate. Over time, this contributes to nocturia, the condition where you have to wake up multiple times at night to urinate, disrupting sleep and draining energy. Scientific research supports this. A study published in the Journal of Urology examined over 2,000 men aged 60 and older and found that those who drank water evenly distributed throughout the day and reduced fluid intake in the evening experienced a 41% reduction in nighttime urinary urgency and frequency. This simple adjustment can drastically improve sleep quality and energy levels. The key is to make hydration a structured habit. Start your day with a glass of water upon waking. Continue to sip water steadily throughout the morning and early afternoon. Aim for 6 to 8 cups per day, adjusting based on your activity level, climate, and kidney health. Avoid gulping large amounts all at once, which can strain your bladder. By tapering fluid intake in the evening, you allow your bladder to rest overnight. Proper hydration also supports other body functions critical to prostate health. It helps flush toxins gently, reduces inflammation, and improves circulation to the pelvic region. Water assists in regulating blood pressure, kidney function, and overall metabolism. If you find plain water difficult to drink, infuse it with lemon, cucumber, or mint for flavor without added sugar. Herbal teas can also be beneficial, but avoid excess caffeine or alcohol, which act as diuretics and can irritate the bladder. In short, hydration is not just about quenching thirst, it is a daily preventive step that protects your prostate, improves urinary function, and enhances overall health. Developing this habit requires consistency, but no special equipment, supplements, or medications. Every sip of water contributes to maintaining prostate health, reducing nighttime bathroom trips, and improving energy and focus during the day. Over time, this small change has a powerful cumulative effect, making it a cornerstone habit for men over 60 who want to stay active, independent, and healthy. Number 2, light walking after meals. Physical activity is essential for overall health, but for prostate health, light movement after meals can be particularly effective. A simple 15-minute walk after lunch or dinner can improve blood flow to the pelvic area, support digestion, regulate blood sugar, and reduce inflammation, all of which are crucial for maintaining a healthy prostate. Walking after meals increases circulation to the prostate gland, providing it with oxygen and nutrients that aid in tissue repair and function. This activity also helps regulate insulin levels and blood sugar. Insulin resistance and type 2 diabetes are closely linked to prostate problems, including benign prostatic hyperplasia (BPH). By keeping glucose and insulin in balance, walking helps reduce the stress these conditions place on the prostate. Additionally, light movement after eating reduces systemic inflammation. Chronic inflammation is a major contributor to prostate enlargement, discomfort, and urinary issues. Studies show that markers of inflammation such as C-reactive protein, CRP, and interleukin-6, IL-6, decrease with consistent, gentle physical activity. Walking does not require a gym, expensive equipment, or intense effort. Just a steady pace indoors, around the neighborhood, or even in a hallway is sufficient to gain these benefits. This habit also supports general health. Improved digestion, enhanced metabolic function, and better cardiovascular health are natural byproducts. Walking after meals can prevent the post-meal spike in blood sugar, improve energy levels, and help maintain a healthy weight, all of which indirectly support prostate health. Men who adopt this habit consistently experience fewer urinary symptoms and a lower risk of developing moderate to severe BPH. Consistency is key. Integrate walking into your daily routine by pairing it with meals. Make it a non-negotiable part of your day, and over time, your body will adjust to this rhythm naturally. Remember, even 15 minutes of movement is far better than sitting immediately after eating. Over years, this small, sustainable habit can have profound benefits for both your prostate and overall well-being. Number 3, regular sexual activity, why it helps and how to approach it. Keeping an active sex life as you get older has clear physical benefits for the prostate and for general health. Regular ejaculation helps clear fluids and waste from the prostate gland. When fluid sits in the prostate for long periods, it can concentrate inflammatory proteins and cellular debris. Regular release reduces that buildup. Over time, this can lower local irritation and help reduce symptoms such as a feeling of fullness, pelvic discomfort, or weak urine flow. Beyond the mechanical clearing effect, sexual activity improves blood flow to the pelvic area. Better circulation brings oxygen and nutrients to tissues and supports natural repair processes. It also relaxes the pelvic floor muscles. Tight, tense pelvic muscles compress on the urethra and worsen urinary symptoms. Sexual arousal and orgasm cause these muscles to contract and then relax, which can reduce tension and make urination easier. Sex also affects hormones and stress chemicals. Intimacy and sexual release can lower levels of cortisol, the stress hormone, and support healthier testosterone balance. Lower stress and improved hormone balance reduce chronic low-level inflammation, which is linked to prostate enlargement and other prostate problems. If sexual activity is difficult because of erectile problems, medication or devices may help, and these options are worth discussing with a doctor. Many men avoid this conversation because of embarrassment, but urologists and general practitioners are used to it and can offer safe treatments or referrals. If pain, discomfort, or bleeding occurs with sex, get medical advice before continuing. For men who are single or whose partner has health issues, masturbation is an effective alternative with the same physiological benefits for the prostate. The important point is regular release, not the context in which it happens. Practical tips: set realistic expectations, communicate with partners, and be patient with your body. If you have heart disease or other conditions that limit activity, talk to your doctor about safe levels of exertion. Use lubrication to reduce discomfort. Maintain genital hygiene to lower infection risk, and avoid forcing activity if pain occurs. Emotional and relationship factors matter too. Loneliness and depression can lower interest in sex and reduce testosterone. Addressing emotional health, keeping social connections, and when needed, seeking counseling can support both sexual health and prostate function. If medications are causing sexual side effects, ask a clinician about alternatives. In short, regular sexual activity is a low-cost natural practice that helps clear prostate fluids, improves blood flow, eases pelvic muscle tension, and lowers stress. It is not a cure-all, but combined with the other habits, it is a practical step men can take to support prostate health and overall well-being. Number 4, targeted nutrition, foods that help and how to build meals. What you eat every day has a steady effect on hormones, inflammation, and the risk of prostate problems. Certain nutrients show clear benefit and are easy to include in normal meals. Start by thinking of food as daily care for the prostate, not as a temporary diet. Lycopene is one of the best-known compounds for prostate support. It is concentrated in cooked tomato products, tomato sauce, stewed tomatoes, and tomato paste. Cooking tomatoes with a little healthy fat, such as olive oil, increases lycopene absorption. Aim to include cooked tomatoes a few times per week. Pasta sauce, stews, or tomato-based soups work well. Zinc is another important nutrient. The prostate contains more zinc than most other soft tissues. Foods high in zinc include pumpkin seeds, oysters, shellfish, beef, and lentils. Adding a handful of toasted pumpkin seeds to salads or yogurt is an easy daily boost. If you eat meat, choose lean cuts and control portion size. Cruciferous vegetables, broccoli, cauliflower, kale, Brussels sprouts, contain compounds that support detoxification pathways in the body and may reduce the risk of cellular changes that lead to cancer. Try to include a serving of these vegetables several times a week. Lightly steaming or roasting keeps nutrients available and makes them easier to eat regularly. Healthy fats matter. Olive oil, nuts, seeds, and fatty fish like salmon provide omega-3s and monounsaturated fats that reduce inflammation. Replace processed snacks and fried foods with nuts, avocado, or a piece of grilled fish. Whole grains, beans, and legumes give fiber and help maintain steady blood sugar. High blood sugar and insulin resistance are linked to prostate enlargement, so managing carbohydrate quality is important. Limit foods that increase inflammation. Processed meats, high sugar drinks, excessive alcohol, and very high saturated fat meals. These can worsen metabolic health and promote inflammation. Instead, favor a plant-forward plate. Vegetables, fruits, whole grains, lean proteins, legumes, seeds, and a moderate amount of healthy fats. Practical meal ideas: a bowl of whole grain pasta with tomato olive oil sauce and steamed broccoli. A salad with leafy greens, pumpkin seeds, chickpeas, and grilled salmon. A stir fry with mixed vegetables, tofu, and brown rice. Small habit changes: an extra serving of vegetables, swapping chips for nuts, choosing water over sweetened drinks, add up fast. If you take supplements, discuss them with your physician. Some men benefit from modest zinc or fish oil supplements, but high doses can cause harm. A balanced diet is usually the safest route. Eating well supports hormones, lowers inflammation, improves weight control, and provides the nutrients the prostate needs. These are practical, everyday choices that protect prostate health while improving energy and long-term health. Number 5, restorative sleep. How sleep supports repair and what to do. Sleep is when the body repairs tissue, clears metabolic waste, and balances hormones. Poor sleep raises inflammation, lowers testosterone, and disrupts immune function, all of which can harm the prostate over time. Restorative sleep helps control inflammation, supports healthy hormone cycles, and improves mood and metabolic health. Aim for consistent sleep of 7 to 9 hours per night. Quality matters as much as quantity. Uninterrupted deep sleep phases are when growth hormone and other repair processes occur. Short, fragmented sleep reduces these benefits. Start with basic sleep hygiene. Go to bed and wake up at the same time every day, including weekends. Keep the bedroom cool, dark, and quiet. Remove or limit screens in the hour before bed. Blue light from phones and tablets suppresses melatonin and delays sleep onset. Avoid heavy meals, alcohol, and caffeine close to bedtime. A light walk or gentle stretching in the evening can help, but vigorous activity late at night can interfere with sleep. If you have trouble falling or staying asleep, address the cause. Sleep apnea, common in older men, fragments sleep and raises cardiovascular risk. If you snore loudly, wake gasping, or feel very sleepy during the day, get evaluated. Treating sleep apnea with CPAP or other measures improves sleep quality and hormone balance. If anxiety or pain keeps you awake, work with health providers to manage those issues. Create a calming pre-bed routine, dim lights, a cup of caffeine-free tea, light reading, or relaxation exercises. Limit naps to short, early afternoon rest if needed. Long daytime naps can make nighttime sleep harder. Good sleep also improves insulin sensitivity and weight control, which link back to prostate health. Men who sleep poorly are more likely to gain weight and have higher markers of inflammation. If medications interfere with sleep, review them with your doctor. Some prescriptions or over-the-counter products can disturb sleep architecture. Prioritizing sleep is a low-cost way to support tissue repair, hormone balance, and immune function. Over weeks and months, better sleep improves energy, mood, and prostate-related symptoms. Treat sleep like a daily health habit, regular, planned, and protected, and it will repay you with clearer thinking, more energy, and better long-term health. Number 6, stress management. Chronic stress is more than just an emotional burden. It has a direct impact on prostate health and overall well-being. When the body experiences prolonged stress, the adrenal glands release cortisol, a hormone that in excess can increase inflammation, impair immune function, and interfere with hormone balance. Elevated cortisol over time is associated with increased risk of chronic conditions, including prostate enlargement and inflammation. Stress also affects blood pressure, heart health, and metabolic function. Poor circulation and elevated blood sugar resulting from stress can indirectly worsen prostate issues. Beyond physical effects, stress contributes to poor lifestyle choices such as overeating, skipping exercise, drinking excessive alcohol, or not getting enough sleep, all factors that negatively affect the prostate. Effective stress management techniques include daily practices such as meditation, deep breathing exercises, and mindfulness. Even 10 to 15 minutes of focused breathing can lower heart rate, reduce cortisol levels, and improve circulation. Gentle yoga or stretching routines also provide dual benefits: physical movement to improve circulation and muscle relaxation, alongside mental calmness. Another powerful method is intentional social connection. Spending time with supportive family, friends, or community groups reduces perceived stress and encourages healthier habits. Journaling or reflecting on positive events can also help manage anxiety and provide mental clarity. Practical approach: set aside 10 minutes in the morning or evening to practice deep breathing or guided meditation. Take breaks during the day to stretch or go for a short walk outside. Limit exposure to news or social media that increases anxiety. Over weeks, these small actions compound, lowering inflammation, improving hormone balance, and indirectly supporting a healthier prostate. Number 7, weight management and body composition. Maintaining a healthy weight is essential for prostate health. Excess body fat, especially around the abdomen, is linked to chronic inflammation, hormone imbalances, and insulin resistance. All of these factors increase the risk of prostate enlargement, urinary issues, and even prostate cancer over time. Abdominal fat produces inflammatory compounds called cytokines. High levels of these compounds contribute to low-grade chronic inflammation, which affects multiple organs, including the prostate. Additionally, excess fat can alter testosterone and estrogen balance, hormones that directly influence prostate growth and function. Practical ways to manage weight include combining regular physical activity with mindful nutrition. Aerobic exercises such as walking, swimming, or cycling improve circulation, regulate blood sugar, and burn excess calories. Strength training, even with light weights or resistance bands, helps maintain lean muscle mass, which improves metabolism and hormone regulation. Monitoring body composition rather than just weight is important. Men can lose fat but gain muscle, which may not significantly change the number on the scale but greatly improves health outcomes. Focus on reducing processed foods, sugar-laden drinks, and refined carbohydrates, while increasing vegetables, whole grains, lean proteins, and healthy fats. Behavioral habits such as portion control, tracking meals, and planning snacks can make weight management more manageable. Even modest reductions in body fat, 5% to 10%, can improve hormone balance, reduce inflammation, and lower the risk of prostate-related issues significantly. Number 8, limiting alcohol and tobacco use. Alcohol and tobacco are two lifestyle factors that can negatively impact prostate and overall health. Alcohol, especially in excess, disrupts hormone balance, increases oxidative stress, and can irritate the bladder and prostate. It also interferes with liver function, which plays a role in metabolizing hormones and removing toxins. Men who drink heavily are more likely to experience urinary urgency, frequent urination, and inflammation of the prostate. Tobacco use, whether smoking cigarettes or vaping, contributes to systemic inflammation, damages blood vessels, and increases oxidative stress. These effects impair circulation to the pelvic region, making it harder for the prostate to receive nutrients and oxygen. Smoking is also linked to higher risk of aggressive prostate cancer. Moderation is key. For alcohol, research shows that limiting intake to 1 standard drink per day for men over 60 can reduce risk without causing nutrient deficiencies. Avoid binge drinking entirely, as it has immediate negative effects on blood sugar, blood pressure, and hormone balance. For tobacco, the most effective strategy is complete cessation. Even reducing usage can provide health benefits, but quitting entirely significantly lowers inflammation, improves lung and heart health, and reduces oxidative damage to all tissues, including the prostate. Resources such as support groups, nicotine replacement therapy, or medical counseling can increase the chances of success. Practical tips include replacing alcohol with water, sparkling water, or herbal tea during social events, and creating a plan to gradually reduce tobacco use if quitting cold turkey isn't feasible. These changes not only protect the prostate, but also improve energy, sleep quality, and long-term quality of life. So thanks for watching this video, and let us know your thoughts in the comments below.